refresh my brain on which topic we were on today. So
yeah. Okay. So there you go. Okay. We are recording. And y'all, you can teach, and I'm listening and putting and making a dress for Barbie at the same time.
All right. Well, I guess I'll start with this, and then Meg, any questions you have, just shoot away. Okay. This is a safe place to talk about all this. As I was talking to my last colleague, can you guys hear me?
Yeah. Can you hear us?
Yeah. It's just that when I talk, I don't hear you.
Oh, so yeah.
I didn't know if that was normal, but
we hear you.
Okay. So, elimination is key. And in our modern world, the standard American diet that we have doesn't allow our colon to work so good. So many people have irritable bowel syndrome, and irritable bowel syndrome is IBS for short, and it's a problem with not feeling like you've completely eliminated. So then, like, what we tend to do is we tend to like push or strain to get the rest out. So that's part of it. Can you hear me, Meg?
Yes.
Okay. Yeah, I think Olivia's muted. That's probably why. Okay. So I get this chart out, and I don't know if you can see it. It's called the Bristol stool chart.
Yeah, I saw that online before.
Yeah. So
and I was going to tell her real quick is make sure to watch, if you haven't seen Dancy's videos, the nutritionist in the Facebook group, to watch those, because she's going to talk about this too.
Yes.
But Janine's going to hit it from a different perspective.
Okay.
Yes. And I often will talk to, and I think like nutrition is probably a biggest part of this, because what goes in comes out. And if your diet is good and it has the things that we need to eliminate better, elimination should be easy. I'm always amazed at my dog. My dog eats the same food every day. He goes out, walks around a little bit, eliminates, and then, us humans, it's like we have to drink coffee, we have to think about it, we have all these things that, and it's never what I would call a clean sweep. or put it this way, if it is a clean sweep, you're doing like a happy dance because you're like, oh, I'm having a good day, So if you have a clean sweep, then you won't have to worry about it. But what I mean by not having a clean sweep is that, like, if you have this is constipation.
Right.
So if you've ever not been able to push, or you haven't been able to get anything out and you have to push, these are really hard to push out, and you're going to strain your muscles in your pelvic floor. So this is probably the worst scenario. Then if you haven't gone in a couple of days, it ends up looking like this. So then it's like clumped together. This is going to create a downward force on that pelvic floor and on the blood vessels, which will create hemorrhoids. So learning some mechanics of pooping is what I call. So it's so funny. I was on the subject today already. We'll just keep going. Some simple things like your jaw. If your jaw is tight, your pelvic floor is probably tight. Okay. So if you have any neck issues or TMJ issues, that can definitely impact this. So what I tell people is when you go to the bathroom, open your mouth. Okay. So if you open your mouth like that, and we're supposed to do this when we have babies too, like when we're in labor, we're supposed to open our mouth, because this sphincter, it's like a circle, and the esophageal sphincter and the rectal sphincter, they're all communicating. So if you clamp down on your mouth and you go to the bathroom, you're also clamping down your rectal sphincter, and then that's going to create a problem where you're trying to push something out of something that's not relaxed. So you want your pelvic muscles to be as relaxed as possible when you void. Some cultures, they go to the bathroom in a squatting position. And here in America, we're sitting on toilets with our legs at 90-degree angles. So the squatty potty was a great invention. Somebody realized that, oh, if I put my feet up on a stool, that is a lot easier to eliminate. So, and I found when my kids were potty training, when they, I would try to put them on a toilet and they wouldn't poop for me. And then I'd find them in the corner in a squat position, and they're like looking at me like, Mom, are you stupid? Like how we go to the bathroom.
We just got potty trained, my little one, and that was what we went through. So
you know what I'm talking about, yeah.
That is his preferred position.
Yeah, and the crazy thing is like we're telling them to do something that doesn't feel natural. So no wonder we're having elimination problems. So if our diet isn't good, and then the mechanics of our muscles are, if we're tight, and then if stool, it takes a while to get through our system because our colon is slow, then certainly all these things impact it. So opening your mouth is really key. Leaning forward or putting your feet up on a squatty potty, and trying to like relax the pelvic floor muscles through deep breathing. So, and practicing that on a regular basis. So if you don't practice it on a regular basis, then when you're in a hurry and you're trying to go to the bathroom, you're not going to know what those muscles are, how to coordinate them. So.
Okay, my question, I guess it's kind of, I wasn't really having problems with this until about a week ago.
Okay.
So is it that by doing these exercises, am I making my pelvic floor too tight, you think?
I don't think so. It could just be something you ate.
Okay, because I haven't really changed my diet. I'm pretty careful. I've got the diet portion pretty good. I follow what he says, and I've been doing that for a while, and that is really good. But I just wondered if maybe I am over tightening. Is that possible?
You could be. I've just seen this. I mean, either some women, they'll reading homework, they can start leaking if they weren't leaking because they aren't focusing also on the diaphragmatic breathing. Are you focusing on the diaphragmatic breathing, like what, say reverse Kegel? So maybe, I don't know, Janine, I don't know what you're, sometimes we can focus on pulling pelvic floor in and engaging TVA. Then sometimes I don't know if it's better for some of the women just to focus on the TVA and not the pelvic floor as much.
Well, yeah, that's true. I mean, if you do the transverse abdominis, you're going to get carryover into the pelvic floor. So you could back off on the Kegels and just.
Okay, because I found it hard to pee lately.
Oh, yeah, you've made yourself too tight.
Okay, I have had problems because I go pee and I'm like, where is this? So I have to try several, like, it's like after I had a baby, it feels like, I can't get the pee out. So
your muscles have to relax to tell the bladder to contract, okay? So if you're too tight here, your bladder won't contract and you won't be able to get the urine out. Same thing with elimination. So that makes sense to me. You probably are too tight. So yeah, maybe don't focus on the Kegel as much as just the transverse abdominis.
Okay, because I've been really trying, because I was like, okay, let the pelvic floor be the leader and really work the pelvic floor. So if I do the TVA, the pelvic floor gets thrown into them. Okay, well then I'm gonna just back off a little bit and see if that.
Yeah, you might be one of our classic overachievers. You're too much.
I probably am. My husband said, Meg, you do everything to extremes.
Yeah.
Okay, yes, I do. I do everything to absolute extremes. So.
Yeah. So, and then like Olivia said, is if you focus on the deep breathing, and you get your diaphragm because you have to lengthen the muscles before you can contract them. So if you've been doing too much of this, you have to make sure you get them to open up. So.
Do you have any help with diaphragm? Because I'm kind of a doofus about diaphragm.
So I'll give you a couple of my tips. Did I go over the belt thing last time, Olivia? Did we do that? Was that with this group? I don't know.
And when I breathe, I do feel, if I have the belt around my lower ribs, I do feel that umbrella sort of open.
Okay. So were you in that group on Friday?
No, but I watched the video, I think. It was posted, or I've seen another one about that.
Okay. Yeah, so that's one way to do it. The other way is to do it lying down on your back and just trying to get the breath to go into the belly. But it's not just the belly, it's the rib cage has to expand too. So you could use the belt lying down too. Okay.
I've been trying to think to the back of my lungs, like breathe to the back of my lungs. Is that diaphragm?
Yes. Mm-hmm.
Okay.
Did you put the Play-Doh up?
To the back and also to the
don't take it over there.
As you inhale, you just picture that air going down to the full bottom lobe, which is, way down by your diaphragm. So, if you're not getting a long enough inhale, you may not be getting the full diaphragm breath. So
I'm probably not getting a long enough one.
And some people I find if they exhale longer, then they can inhale longer. So if you are to blow out and you blow out through your mouth, then your lungs will recoil and you'll take in more air on the rebound.
I have noticed I have trouble. My exhales are really short. Like when I'm doing the triple pistons, I run out of air.
Okay. Yeah, your diaphragm, did you have a C-section or did you have vaginal birth?
Vaginal.
Okay. You probably still have tightness under your diaphragm. So hold on a second. Let me lower this. So if you put your hands under your diaphragm, like right in there, your ribs, you just can I would do it right on your skin. And you can even take lotion and do what we call J strokes, where you just kind of like massage it.
Have you tried that yet, Megan?
I have. I did that the last time. I haven't been consistent though.
Did you find that you had tension there?
It feels tight.
Yeah.
Is it like, it's tension if it hurts?
Yes. And
okay.
then, so do that, but then also try to dig your fingers in there. Like I know I have a trigger point right here because that hurts when I do that. So you kind of like just grab a hold of it and it'll feel like it's taking away your breath and then it'll go away after maybe a minute. And then you'll go, oh my gosh, I can breathe so much more. So if you have a trigger point holding that tight, that's going to impact it. And then, if you're doing the belt breathing, that's helping with the rib cage lowering. But yeah, sometimes we have these trigger points under our diaphragm.
Okay, I'm not feeling any tightness there, really.
You don't feel anything?
I don't feel much tightness. I feel a muscle. I'm pressing on
it. Do you feel pain? Do you feel pain?
No. I'm pressing on something. I feel something. So, but I don't feel any pain. Whoa, yeah. Okay, I just hit something. Never mind.
So once you find that spot, you just hold on it until it goes away. And then afterwards try to breathe and it might make a big difference.
Yeah, it did.
So when I have people that have that, I actually wrap my arms around them and I dig in and I pull them back and I do like a fascial release on them. But I find that for many people, we just felt hands underneath our ribs. So
cool.
Yeah.
So could her husband do that behind her?
Not really, because it's an advanced skill. But I think just finding that trigger point, you might find it also better when you're lying down, so you're not like your muscles aren't active, they're more quiet.
Okay.
So try that lying down too. And it's really amazing because like I don't even have pain there. I'm not aware that I have pain, but when I press there, I can feel there is some tension there. And if it's tension, it's like the muscle's in a knot like that, and so that shortens that muscle. So when you go to breathe, your diaphragm's going to be like in a contracted state. It's not going to let you expand as well.
Okay. Yeah, I'm going to do that. That feels good, actually. Now I'm kind of just messing with it, and now it feels good.
Good. Which side is it on?
It was on my left, of course.
On your left side, okay.
Every problem I ever have seems to be on that left side.
Do you have left hip issues too?
I find that I tilt, like my husband was watching me the other day, and he said, your right leg is bigger than your left leg. So I like baby my left leg, I guess. And he said, the muscle in your right leg is definitely bigger than the muscle in your left leg.
Like in your calf or in your thigh?
In my thigh.
Okay.
And the chiropractor has said that I tend to tilt to the right.
Okay.
Like I favor the right and put more weight on my right. So I let the left, I baby it for some reason. I don't know why.
Are you hanging babies on that hip?
I used to. I don't anymore.
Do you know about Pilates? There's a power pose called posture power. Do you know what that is? This might help you. I know for me, to get out of that habit of doing that, I had to work on this. So what you do is you stand with your feet rotated out. So my feet are like this, okay? So heels are together, toes are out. I think I'm too close so you guys can't really see me. And then what you do is you stand with your toes out, and then you turn your hands like this, and you squeeze your butt. Right? And when you do this, many of us kind of stand like this. You kind of have to get your hips over your heels, and you're just squeezing. You're holding that for 10 seconds, or actually a minute, 30 seconds to a minute. And what that does is it really trains you to not hang your hips to one side. So I used to stand like this, or I'd be like this, and now I can just stand like this when I'm talking to people because I'm in the middle. So I'm equally balanced with my hips, and I'm not swinging my hips to one side. Does that make sense?
Yes.
Were you able to see me okay? I know I was too close to the screen, but.
That's good. I've got a little guy bringing me stuff. So that makes a lot of sense. I will try that.
Yeah, it's a Pilates pose, and then you can do it like every day throughout the day, many times. I know when I'm feeling tight, I just get into that pose, and that really helps me. And then I also will find that when I'm out in public, I don't want to be like tensing, and you don't want to, again, don't grip, don't grip all day long. Just grip for that 1 minute. And then when you're out in public, you can just stand with your feet out like that. And then you're going to have less tendency to like hang your hip one way, you know? So when I stand for a period of time, I just stand with my hands in front of me. I can stand for an hour like that, you know? So I'm not having this imbalance of my hips swinging to one side.
Okay.
So that's my new normal. But I learned that after having 3 babies. Like my youngest was already older, and I'm thinking, wow, that would have been really helpful to have, you know? So.
Yeah. I don't know why, but it just feels more comfortable sometimes to lean like that.
Well, it's just because of weakness and habit.
Because I was noticing at church, we stand a lot in our church, and I started after about 30 minutes. I was really tilted, and I thought, that's weird. Why are you tilting like that? You're not even holding a baby. But I started slouching.
Yeah, it's fatigue in the core. So when your core, you know, can't hold you any longer, then you just hang on your hips, and you don't have any muscle to do that. But it's not good for your pelvic alignment, and it's not good for your back or your hips or anything like that.
No, it's not. Well, after your work on those things, that will help a lot. I'm excited about the diaphragm thing. That was awesome. Like,
yeah, you'll get a better breath.
I definitely feel a difference. I can breathe.
Good.
Cool.
Yeah, that's very important. That's probably like the most important part is learning how to relax the muscles so that they can contract better.
Well, it sure did something.
Yeah, so, you know, you may have to do it a few times until then. Like, I would just check it every day and see how you're doing with that.
Okay. That sounds good.
And then once you get the spasms out, you might not need to do it. But, you know, keep in mind the colon runs up under the ribs. So if we get gut irritation, sometimes then the diaphragm, you know, contracts underneath too. So, but it sounds like you're doing good on the diet part. So that's good.
I've been doing Trim Healthy Mama for a long time, and then I changed it up when I learned about Dancy's stuff. So it's all been working really well. That's good. Everything's going good. It seemed like about a week ago I started having hemorrhoids, and I was like, this is worse than when I was pregnant. And then I couldn't pee, and I was like, what is going on here? And I think we solved it today. I think I'm just overdoing it. Yeah, and remember to open your mouth. Yes. Because we have a squatty potty, and those things are cool. Those things are really good.
Janine, is the one that you do like this with your feet, would that help her pelvic floor?
Yeah. Let me show you that. So,
that one.
The hip. What?
Oh, Olivia it's the sitting down where you just go like this with your feet.
Yeah, but I want Janine to kind of explain it a little bit. So
you guys saw my video, or you saw the video where the hips are like a hammock.
I haven't gotten to watch it yet, but I will.
Okay, so the pelvic floor, I gave a anatomy lesson of the muscles. So the muscles attached to the hip on the side. So front to back, the pelvic floor is like a hammock this way. And then on the sides, it attaches to the hips. So if you have tension in one of your hips, it can kind of pull it sideways. But what you want the pelvic floor to relax and contract like this, okay? So you want your hammock to be slackened, and then you want it to be taut. Okay, so the exercise to get that to happen is to lie on your back. And you can either do it with your knees up or your knees straight. But if you do it with knees up, I always feel like a contortionist when I'm trying to do these videos. Okay. All right. So what you do is you inhale. You have your feet shoulder width apart. You inhale. You go out with your knees, and then you exhale like that. So you inhale, and then you exhale. Okay. So if your knees are bent, that muscle that attaches to the pelvic floor is what we call a hip abductor. It's going in and out. But if you have your legs out, you can then do it this way, like windshield wipers. Okay, so the breathing would be inhale on the opening, and then exhale when you close. Inhale, and then exhale. Okay. So, and we had another mom who, she kind of taught us that when she does that, it helps her jaw and her neck tension and her headaches. So it works both ways. If this is tight, the pelvis is tight, but if the pelvis is tight, this is tight. You know, so we start to see the relationship going back and forth, up and down.
Yeah.
So it's a breath in. I call it windshield wipers. Your feet go out and then they come back together. And when you do that, you're literally getting your pelvic floor to do this and this.
Are you engaging your TVA as you exhale, or it's just
no? It just comes in automatically. I'm just focused on, and I'm not even focused on getting the belly to expand. It automatically should do that. It's just more of what you're doing with the hips.
Okay, because I find if I get too much stuff in my head, I can't do it. So it's good to do the one thing. Okay.
I find as many ways as we can get those muscles to coordinate. You know, you want to have many different ways of going about it. You know, it's like if the muscle isn't getting the message one way, if you do it another way, you're going to get it. So having as many different ways to go about it is going to help you.
That's cool.
So, and you're getting your breathing at the same time, which is helpful.
Yeah. I don't know if this might help explain something or not, but after I had my second baby 5 months ago, I felt like I couldn't breathe for several weeks. I felt like I couldn't get it. I was short of breath all the time. Is that from the diaphragm stuff?
Probably. I think shortness of breath in pregnancy is because of the rib cage expanding. The diaphragm is getting stretched out, so it almost gets like a spasm in it. So, and the attachment point is too far away, so it ends up being very inefficient. So the diaphragm can't contract when the rib cage is elevated.
Okay.
Out. Which is why the belt works, you know, if you get the belt to pull those ribs back in.
So it's gotten better, but it was for about a month after she was born. I felt like I could not take a full breath.
Mm-hmm.
So
yeah, you're probably in a spasm in your diaphragm.
Yeah, and now I know what to do.
Yeah.
Great.
That's awesome. Yeah, so it's all connected.
Yeah, that's amazing.
I know, it is.
And I think that was a great question, because there's probably other people that will have the same question about, like, maybe when they can't empty their bladder. I find a lot of people stop at the bathroom too often because they're not emptying their bladder in the first place. Mm-hmm. So if your muscles are tight, you're not going to get the bladder to squeeze or contract. And then an hour later, you have to go again because you never really got that urine out to begin with. So urinary frequency is a symptom of pelvic floor dysfunction, and it just means that the pelvic floor didn't know how to relax to tell the bladder what to do. So that's a really, like, probably common thing. It's probably one of the most common things I treat here at my clinic is frequent urination, frequent trips to the bathroom, or getting a sudden urge that if they don't get to the bathroom, they're going to have an accident. But that relates to the hemorrhoid issue too. And, you know, people are afraid to ask these questions, but, you know, we have to talk about it because it's part of the whole equation.
Yeah,
I'm pretty sure my mom has pelvic floor dysfunction. She's always dealt with hemorrhoids, going to the bathroom. Like, it takes her ever to go to the bathroom. I'm just thinking, Mom, it takes you forever. Like when she says like if we're gonna go somewhere and she says I have to do something. So
it's a life issue, a quality of life issue, really. I mean, it's very impactful. I mean, it makes people not want to travel or go places in a big crowd because they're not sure where the bathroom's going to be. I mean, it's a major thing.
Yeah. I was just sitting here thinking about all that. I told you my mom's the one who lives in chronic pain with back issues.
Yeah, well, I'm
When
sure it's all connected.
it is, yeah. So,
We can talk some more about that specifically, because I'm sure like taping might help her back, or checking her hips.
well, she's got rods in her.
Oh gosh.
She's had nerves that were like seared, and they've had to try to fix nerves, and she'll be just sitting somewhere and like go because the nerves like.
Yeah, that's definitely once you have surgery, it does alter a lot of things, but it's never a lost, like, oh, this is as good as I'm going to get. Sometimes even like I have a lady right now who has she's had a bunch of backs, I think 4 or 5 surgeries, but I started dry needling her, and then I tape her, and her bladder issues are better. So, and I told her about that. I said, if your inner thighs are holding you together because your core isn't, so I didn't really even give her that many core exercises because she sleeps in a recliner. She doesn't even, she's so sedentary. So.
And my mom, she does try to move, but it's pretty, she lives, like, even if she's in pain. And now they found out she's got 2 more herniated discs. And so like.
The more she sits, the worse that's going to get too. So yeah, she has to, it's a catch-22 for sure.
Yes, she knows that.
Yep, that is not a good situation, but she can still improve. She can still improve. She might need some hands-on help though to get that to reduce.
We don't know where to take her to.
Yeah, we can talk about that.
Okay. Well, Megan, do you have any more questions for Janine for this session?
I was wondering, what are the daily life activities that I need to engage my abs or engage my TVA to be safe about? 'Cause I already do for a lot of things, but I want to make sure that I'm doing it. I don't know, just what activities should I be safe about?
So laundry, groceries, babies, vacuuming, it's your whole day. Anytime you're picking yourself up out of a chair, getting out of a squat, picking anything up. So your body is weight. So, when you get out of a squat position and you go to stand, you need to exhale. So if you exhale, you're engaging your TVA. And, you can be conscious of it, or you could be just exhaling, and at least when you exhale, the diaphragm will pull the pelvic floor up like that. And then that will cause the TVA to kind of come together. So just the nature of, by you practicing the exercises, then when you exhale during your daily tasks, you're engaging those core muscles without even knowing them. But the key is you got to breathe right. So not holding your breath. You pick up a laundry basket, blow out. You take the trash out, blow out. Blow out through your mouth. You lift groceries, those infant carriers. So exhale with exertion, and then you're not bulging out your belly either.
Okay, so anytime you're going to exert yourself, basically. Yeah.
So I'm sure you're doing multiple things all day long. So just think you're exercising all day long, really.
I guess
knowing it.
The thing was, the other day I reached for an empty cup across the table, and I kind of felt something weird. Should I have engaged to just reach across and grab that empty cup?
Probably.
Wow. Okay. So it's even something that minor.
Yeah. If your arms are going above your head, because that's going to arch your back. So you probably were in a position where your rib cage was flaring. So yeah, that's when I would exhale.
Okay.
So if you exhale, more than likely that's going to pull that in, and at least you're going to prevent that holding your breath and push it out.
Okay.
Because you're not going to remember every time. And the best way is to train yourself by doing squats and coming back up from a squat. Then you're going to get that pattern down. It's going to be automatic. Right now it's not automatic, I'm sure.
Yeah.
Or maybe it is. You're getting there.
No, I have to think about it for a lot of things. I thought, wow, what was that muscle that did that? Because it was it's like I just reached across. So even just reaching across and
opening up a window, that kind of stuff.
What was the other thing? Oh, I lay on my side to nurse my baby a lot. Is that okay?
What'd you say, you sighed in the bed?
I lay on my side a lot because she really likes to just lay. She's a very lazy little baby. So is that okay to just lay on your side?
Yeah, I mean, if you do that, just put a pillow between your knees or use your body pillow kind of thing. You're not going to sit there and probably, I mean, you could blow out while she's nursing. That's what I used to do. So when my babies would feed, I would do 10 TVAs. Like I would go. You can engage your core laying on your side too. So if you want, I mean, unless it's like middle of the night, you're not going to want to do any exercise.
Yeah, and flip-flop sides, like if you do that. But just don't focus on, I'm just sitting here thinking, I don't want you to focus on the pelvic floor. Just focus on breathing out in your TVA. That way you don't overdo it.
I notice when I'm laying though, I'm not like straight up and down on my side. I'm kind of canted a little bit.
That's all right.
Okay.
As long as your stomach's not bulging out.
No, it's not bulging. I just find myself, I guess, kind of at a bit of an angle instead of just straight hips and straight chest, because I kind of lean like that. So.
Well, you can't be perfect all day long.
That's what I was going to say. You just can't be all day.
You know, you got to feed your baby, and there's times that you're going to be in positions that, you know, as long as you're not like, as long as you're making the other changes in your daily tasks, and this is a lifelong thing too. So once you get past this healing, you're going to want to continue to exhale. Like I don't even think about lifting anything without blowing out, because once you heal the diastasis, the next risk is organs falling down. So you don't want to ever hold your breath and risk that your bladder or your bowel or your uterus is going to come down, descend, you know, come down. They call that pelvic organ prolapse. So you don't want that to come down either. And women are at risk for that after we've had babies.
Wow. Okay.
So if that gives you any motivation, you know, lifelong.
Yeah, just get this taken care of and learn training for new habits, because
Yes.
There's so much I did not know. After my first was born, I knew I had diastasis, and I went to a physical therapist, and she gave me some things to do, but we didn't talk about alignment, and we didn't talk about how to protect yourself before you do something. You know, it was just kind of she even said, I don't know how to treat you. I've done a little research, and this is the best I can come up with. And so it helped, but it wasn't a lot.
Do what, Jane?
Most PTs are not trained in this. I had to get special training. All the people, you know, that worked with me, we've had special training, and it's an ongoing thing, because we used to just do Kegels, and now we're cognizant of the fact that it's more than just one muscle that does this. It's 4 muscles that work together. So that's why like if someone has a C-section, I don't have them focus so much on the TVA as the Kegel. I have them work from the inside while they're healing from their C-section. And when someone has a vaginal birth, I say the same thing. It's like the pelvic floor is trying to heal. Let that heal and engage your TVA instead, you know, because they work simultaneously or as synergists. They're muscles that work together. So, and years ago, we used to hook people up to biofeedback and tell them to shut down the abdominals while they were doing a Kegel, and they couldn't do it. And we were frustrated, and they were frustrated. It's like, duh, they work together, you know. So we learned a lot as we went along, but most of the current information is like state of the art, and we're all speaking the same language. But you could see one pelvic floor therapist who would just tell you to do Kegel exercises, and then you could see somebody else who's going to address the whole body and the system, you know, of the full course. So we're not all trained the same, and some of us are just getting started in it and are like newer at it, and some of us have more training. Like I have 20 years in pelvic floor stuff. So, and before that I treated orthopedics for 5 years, you know, with hips and backs. So they were honest with you and told you that that's all they could do. And honestly, that's probably what I would have told somebody years ago when I didn't know what I was doing either. Because many PTs are seeing multiple body parts like shoulders and ankles and knees. So it's hard to get good at one thing. And that's the challenge we have in our profession. So everything I treat is like one part of the body. So I got really good at that. And now I'm not very good at treating other things like ankles and knees, but that's okay. There's other therapists who can do that. Mm-hmm. So.
Cool.
What's the difference between that and physios?
Oh, it's same thing. It's just if
That's
you're
what I
in
was-
like Australia or I like British, if you're like in another country, like European countries will call them physiotherapists.
Well, I've always thought that they just don't sound any different to me. But there's physio and pelvic floor physiotherapists, right?
Yeah, so it's like a pelvic floor physical therapist. I think even in Canada they're called physios. We're probably the only country in the United States that calls us physical therapists. Everybody else is a physio.
Do some, because somebody thought that like the physios or somebody did internal work and the physical therapists didn't. Yeah.
Nope, it's just another word for the same thing. So, but not all physical therapists do internal work, and even not all pelvic floor therapists do internal work. I know when I was starting out, I didn't want to do that part of it, and I said, well, I'll do the training for the biofeedback. I'll treat pregnant women, but don't ask me to do that, you know. And then I went to my first pelvic floor course, and you'll find this interesting, Meg, is that I found I could go to the bathroom so much better after I had those muscles like examined and released. And I went home from the course and I was like, so this is normal. Like I didn't even know it was abnormal. And I was a piece. So it really was eye-opening. And then like along the way, will get tight in my muscles if I get constipated or if I eat something that I shouldn't have, or if I'm not active enough, you know. So it's on a continuum, you know. It's not always, we don't always have good elimination every single day, but the goal is to have that happen so that you can reduce the strain.
Yeah. Well, things were going pretty good till I overdid it. So
yeah, let us know how you're doing. I think just that little tweaking should make a difference.
Cool. Because it's really baffling. So that's.
Yeah, and you know, when I was learning, you know, they would say, well, you have to lead with the TVA and not the pelvic floor. And then they're like, no, you have to let the pelvic floor be the boss and not the TVA. And I don't know what your thought about that is, or if it's going to be different for each person.
That's probably a question that will be pondered for years.
Okay.
I mean, the research does say that you're supposed to do the pelvic floor, then the TVA, then the multifidus. I mean, it's like a 1, 2, 3 contraction. But it depends on what why you're doing it. If you're doing it because someone's leaking or someone needs back stability, that's the reason. But if someone has pain, then we don't want to tense all these muscles. We want to get them to lengthen first. So yeah, I think it is an individual thing. And that's where like we ran into trouble, where we were just assuming everybody had weakness and had to do Kegels, but we weren't addressing the tightness that they had. And now we are. So that's the difference.
Yeah, see, and that's what I was thinking. I mean, that's what I've seen this whole time. I don't just actually ask that question. But
yeah, so, and just as an individual thing, just ask people if they're in pain, or like if they can't have sex comfortably, or if they can't eliminate, like to go to urinate, then they probably have clenched muscles that need to be released first. So. But this was great. You had great questions today. I think a lot of people are going to benefit from this.
You helped me a lot. So just getting the diaphragm into the act is going to fix all of that tightness.
Backing off a little bit on that Kegel.
Okay.
Well, probably a lot. You just engage your TVA.
I was really struggling and trying. I was like, I can't even find my pelvic floor. So I found it then, and I said, "Hey, I found my pelvic floor." And then I guess I asked it to do weight. So, whoops.
It's okay. Live and learn, and you know, it's only been a week, so you can unlearn that pretty quickly.
Yeah.
And then you can engage it, but you know, don't engage it 100%, or I think you were probably doing it 200%, but you know, just you'll still engage it. You'll be aware of it, but you just won't be clamping down and tightening it so much.
yeah, so on the pistons and stuff, just do the TVAs. Focus on, and it'll be good. And focus on reverse Kegels, the diaphragm rounding breathing.
Okay.
Yeah. Too.
That'll help a lot.
All right. Well, are y'all good? So, okay. Well, then we'll see y'all next week. And we'll do the mindset Thursday as well, and I'll post in the group. Okay?
And then we'll do Wednesday next week, right? Is that what the plan is?
Wednesday next week. At what time? I forget.
Oh gosh, 9:45 Eastern time, so that would be 10:45 your time, right?
No, wait.
8:45. I'm sorry, I was
8:45.
So 9:45 8:45 Central, right?
No,
That's
it'll be 8:45 our time.
Okay.
9:45 my time. Yeah.
Yes. Yeah. Okay. Yep. We got it. All right. See y'all later. Thanks, Janine. Bye.
Thank you.
You're welcome. Bye.